Hello, it's Dr. Rhonda Johnson. Today is Monday, April 1st, 2024, and I'm talking about diphtheria. Why diphtheria? Because the World Health Organization posted on its Instagram's page that diphtheria is on the rise. Now, diphtheria is endemic to many regions around the world. In the Americas, you can find it in Haiti and the Dominican Republic. It can be found in Asia, in the South Pacific, parts of Africa, Eastern Europe, and the Middle East. Now, as of February 25th this year, there have been 35,000 suspected cases of diphtheria that were reported across Nigeria, Guinea, Niger, Mauritania, South Africa, Cameroon, and Gabon. Now, Nigeria was the most severely affected and accounted for 78% of cases and 70% of deaths. Why? I'm not really sure, but it could be a combination of disruption in global vaccination due to the COVID-19 pandemic, erosion of some public health infrastructures, armed conflict, mass migration of people due to conflict. All of these things can set up for conditions that lead to a lack of childhood immunization. So what is diphtheria? It is a very serious infection caused by strains of bacteria called Corynebacterium. Symptoms of diphtheria include fever, sore throat, neck swelling, and difficulty swallowing. People usually have symptoms in 2 to 5 days. Now, the bacteria makes a deadly toxin that kills tissues, especially in the respiratory system. Within 2 to 3 days, these dead tissues form a thick gray coating that can build up in the throat, and this coating is called a pseudomembrane. It can cover tissues in the nose, the tonsils, the voice box, and the throat, making it very hard to breathe and swallow. Now, if the toxin gets in the bloodstream, it can cause heart damage, nerve damage, and kidney damage. Now, how's it spread? It's spread from person to person, usually through respiratory droplets, like from coughing or sneezing. People can also get sick if they have cutaneous diphtheria on the skin by touching infected open sores. So what about treatment? Treatment usually involves using diphtheria antitoxin to stop the bacteria toxin from damaging the body, but this can be in limited supply because it takes a long time to make it, and it's made from the blood of horses. Also, antibiotics do kill and get rid of the bacteria. So what are the complications of diphtheria? What makes it so serious? Well, again, you can have an airway blockage, myocarditis, which is damage to the heart muscle, damage to the nerves, kidney failure, and death. With treatment, 1 in 10 people die. And untreated, it has between a 30 to 50% of mortality. But here's the most important thing I'm going to say today. Diphtheria is a vaccine preventable disease, folks. You can get this shot when you get your pertussis and your tetanus shot. In babies, they get it at 2, 4, and 6 months, then boost it again at 15 to 18 months, 4 to 6 years. Preteens get a booster between 10 and 12, and adults should get a booster every 10 years. To me, that diphtheria is making a comeback is just absolutely incredible. I would have never believed this would happen. I've been a physician a long time. I've never seen a case of diphtheria. And again, this is a vaccine preventable disease. Vaccines are safe. They can get the disease incidence to a very low rate. Now, folks, we have never eliminated diphtheria, even though humans are the only known reservoir of this bacteria. But we can get the incidence close to zero, and that's through global vaccinations in both resourced and under-resourced nations. We've got to keep this a priority. That's my message today. Be well, folks, and take care.